let us see which are all the drugs which can cause some important teratogenic effects. So first of all, let us take the drug that is thalidomide. So thalidomide is the one which will going to cause the teratogenic effect called as phocomelia. It is also called as seal-like limb deformity. Next comes the warfarin. Warfarin will going to cause fetal warfarin or a warfarin fetal syndrome. It also causes contrary syndrome. So warfarin causes contrary syndrome. Whereas phenytoin will also cause phenytoin side effects. So it causes hydantoin syndrome. Hydantoin syndrome. Phenytoin causes hydantoin syndrome. Next is the carbamazepine. Carbamazepine will also cause some teratogenic side effects. Among that, a very important side effect is the neural tube defect. Neural tube defect. And next comes the methotrexate. So methotrexate will also cause a very important side effect, that is the neural tube defect, because of their folic acid antagonistic activity. Then comes the isotretinoin. So isotretinoin has got multiple teratogenic effect. It can affect the CNS system, it can affect the cardiovascular system, it can affect the ocular system, it can affect the facial system. So multiple teratogenic effects are involved with the isotretinoin. So what about the carbimazole and the methimazole? So please remember, carbimazole and methimazole being a antithyroid drugs, they can lead to lead to hypothyroidism. So apart from the hypothyroidism, it can cause aplasia cutis. So that is a defect in the scalp. Apart from that, the carbimazole can cause esophageal atresia, as well as the coronal atresia. So next is the ACE inhibitors. As you know, ACE inhibitors are known to cause renal dysgenesis, as well as it will going to cause the growth deformities. It will also reduce the growth, so it can cause growth abnormalities. So what about the diuretics? So diuretics can also have similar side effects to that of the ACE inhibitor, such as the growth abnormalities as well as the renal dysgenesis, which are associated with the oligohydramnios. So next is the lithium. Lithium will going to cause a side effect called as the Epstein anomaly. Then comes the tetracyclines. As you know, tetracyclines are known to cause the side effects which are involved with the teeth. So it can cause discoloration of the teeth, it can lead to deformity of the bones, it can cause deformity in the teeth. So these are some of the side effects. So next drug is the cotrimoxazole. So as you know, the cotrimoxazole is a combination of sulfamethoxazole and the trimethoprim. It will going to cause yellow discoloration. So it can cause kernicterus. Whereas the quinolone group of drugs will going to cause the arthropathies. It can cause tendinitis. It can also lead to the defect in the cartilages. So cartilage damage can occur with the fluoroquinolones. So then comes the erythromycin. Erythromycin can lead to CHOPS, that is the congenital hypertrophic obstructive pyloric stenosis. So these are usually seen in the children's. So these are the congenital deformity that leads to pyloric stenosis. Pyloric stenosis in the newborn. The newborn will have a olive-like lung features due to this deformity. So apart from that, you should also remember the erythromycin will also cause esophageal atresia as well as the choanal atresia. Then comes the diethyl stelbestrol. So what does this diethyl stelbestrol causes? If the diethyl stelbestrol is consumed by the pregnant woman, it can lead to clear cell vaginal carcinoma in the female offsprings, and also it has found that in the males it will also lead to testicular carcinomas in the later part of the life. So what about the misoprostol? So misoprostol can cause Mobius syndrome. Streptomycin being a aminoglycoside, it can lead to ototoxicity as well as nephrotoxicity. And a COX inhibitor, if it is used in the third trimester of the pregnancy, it can lead to premature closure of the ductus arteriosus. So what about the quinine? Quinine, which is used is one of the drug which is used commonly in the treatment of the malaria. So it can lead to retinal deformity, and also it can lead to decreased hearing ability. Mainly there will be a retinal deposition. It can lead to retinal abnormality, so it can lead to retinopathy. So and also it can lead to congenital deafness. So what about the amphetamine? Amphetamine will going to cause the hepatic calcification as well as the heart disease. And apart from that, there is one drug which is will going to cause a gray baby syndrome. Can you guess which is the drug which is going to cause gray baby syndrome? The drug is the chloramphenicol. So apart from that, these are the congenital side effects which are associated with the drugs. So there are some other syndrome which can be asked in your exams, like Redman syndrome, which is commonly caused by the drug vancomycin. And there is a name called as blue baby syndrome or blue man syndrome, which is caused by the amiodarone. So this was all about the drugs and their important teratogenic side effects. So this is one of the important topic which you should need to revise before going to the any competitive exams, because this topic can be asked in every exam. At least one question will be asked from this topic. Good day. Thank you.